Good morning. Thank you to Coach Bates for the wonderful introduction, and thank you to Father Gavin and the vestry for allowing me to speak today. Many of you might not know that I have a chronically ill, special needs 22-year-old brother, Nick. He is the heart and soul of our family, and honestly, one of the coolest, smartest, funniest people that I know. But life has been very challenging for Nick, and it has been hard for my family. To say that Nick has been through a lot would be an understatement. As an infant, Nick was diagnosed with a rare neurological disorder called tuberous sclerosis. This horrific genetic disorder causes tumors to grow in all major organs, some of which can be life-threatening. Nick was born with 28 brain tumors, 5 heart tumors, and now has tumors on both kidneys and on his skin. In addition, Nick has autism, developmental delay, multiple types of seizures, behavioral issues, kidney disease, and various other medical problems. Eventually, his needs required 24-hour medical care, forcing my parents to put him in a residential school when he was just 11 years old. To give you a perspective on the severity of Nick's diagnosis, his neurologist at CHOP said that this was the most complex case of tuberous sclerosis that he'd seen in his 30 years of practice. From the outside, this might look like a hopeless situation. But I'm not looking for sympathy, and neither is Nick. Because Nick's story is a story of hope in his 30 years of practice. From the outside, this might look like a hopeless situation. But I'm not looking for sympathy, and neither is Nick. Because Nick's story is a story of hope. Despite unimaginable challenges, both medically and developmentally, Nick has accomplished remarkable things. And hope has been the driving force. Although there are countless stories I could tell you about Nick's strength and determination, today I want to share 2 specific complications that he's endured that will help define his story and journey of hope. As I previously mentioned, Nick has seizures. At one point in time, Nick was having up to 30 seizures per day. So to potentially get control of them, he went through his 3rd brain surgery. But post-operation, Nick had a stroke. He woke up paralyzed on the left side of his body, and the doctor said to my parents, "Nick may never walk again, and he might never use his left arm again." Nick is left-handed. We took him home in a wheelchair and set up a bedroom on the 1st floor where it'd be more accessible. But within days, Nick learned to go up and down the stairs by sitting and pushing off with the right side of his body. For months, my mom dropped me off at school and then took Nick to a rehab center for daily therapy. Nick spent hours each day working on physical therapy, occupational therapy, and aquatic therapy. But these were hours each day spent in frustration. Because keep in mind, Nick is autistic with an IQ of 41. These daily struggles would be hard enough for someone like you or me, but Nick couldn't comprehend what had happened to his body. And after many long months, Nick's strength started to come back. By the end of summer, he wasn't just walking, he was running. Yes, running around the backyard. It was a miracle. Another time was when he went through puberty and his behavior spun out of control. Sadly, he was admitted to an inpatient behavioral unit at the Kennedy Krieger Institute for 11 months. My parents were told this was the second longest stay for any of their patients. Nick hated being there and would cry himself to sleep each night, begging staff to let him, quote, go home. When we visited, I would take Nick his favorite treats and movies or a new book to try and make him happy. And these small gestures often did put a smile on his face, but they certainly did not outweigh the pain that he was going through. After 11 months of being stuck at Kennedy Krieger, Nick improved his behaviors. And he improved his behaviors well beyond what the doctors had hoped for. These two stories are stories of hope. Although Nick faces daily struggles trying to function in a world that often doesn't understand him, he still has quality of life. Nick enjoys someone reading to him, loves all things Disney, especially movies, has great taste in music, Bob Marley, Elvis, and Bocelli to be specific, goes on daily walks, swims at the Y, and adores his friends and family. Nick volunteers at his agency, shredding paper, and has helped at stables making beds for the horses. And like the rest of us, he has chores. Nick does all of the shopping for his group home, helps with laundry, and is an expert at cleaning out the dishwasher. When you are out in the community and you see someone like Nick, be kind. I hope by sharing Nick's story, it will inspire others to stay strong, persevere, and allow hope to motivate them when times get tough. Nick is my hero. He has taught me invaluable life lessons and helps me keep things in perspective. In the words of Martin Luther King, we must accept finite disappointment, but must never lose infinite hope. In silence, let us reflect on what we have just heard.